Welcome to the Health Champions Podcast, helping you take your personal health to a whole new level. Hi there, I'm your host, Derek Little, and this is the podcast for people of all ages looking for ways to better manage and improve their health. As a Canadian, I'm well aware of the flaws in the Canadian healthcare system, especially the long wait times. On the other hand, U.S. patients on low-income Medicaid get seen much faster, an average of 4 times faster in emergency and 6 times faster to see a specialist. But the U.S. healthcare system has its own set of challenges. These include a shortage of nurses and doctors, the opioid crisis, and poor patient outcomes. Today, I'm honored to be joined by Myra Katz, a patient healthcare advocate located in Baltimore, Maryland. In this interview, she explains what a patient healthcare advocate does and how to find the right one for your needs. Later in the show, I speak with one of Myra's clients who had a condition so severe it's being used as a case study by the hospital where she was treated. Myra then explains her process for helping her client avoid the poor patient outcome that she was headed for. Here's what Myra had to say.
I'm a physician assistant, and I've been a physician assistant. I graduated George Washington University School of Medicine and Allied Health here as one of the first classes back in the late 70s. I worked as a PA for probably 35, 40 years doing adolescent health, women's health, hospital-based medicine, and oncology and hematology and palliative care. I burnt out after a while, after many, many years. In about 3 years, I decided to change course and become an advocate, which is what I was doing all along with my patients. And what an advocate is there's different kinds of advocates, I should say. I'm a medical-based advocate because I understand the healthcare system. I don't give advice. I don't prescribe any longer. I don't act as a PA. What I basically do is I interpret what's going on with your healthcare needs, and I help you navigate the system to make it easier for you to get through, to get appointments, to understand what your doctor's saying, and for you just to become a more responsible consumer and be able to make educated decisions for yourself.
What are the top qualities of a patient healthcare advocate?
For me, I think the most important quality is listening, understanding where your clients are coming from. Frequently, they call me in a state of panic. For example, they were just diagnosed with cancer and they don't know where to look or how to start. They go on to Dr. Google, they call their friends, they call their family members, and they have instructions all over the place and all different kinds of information. So my job is to listen and break it down into pieces and help them figure out what direction they need to go in and get there. And the other thing is knowing my limitations. There are certain things I'm good at in terms of being an advocate and certain things I'm not. I don't do insurance. I don't do billing, but I'm really good at the medical aspect, understanding what tests need to be ordered, understanding what's going on in terms of your treatment. And I can help guide you to make your decisions. I will also research anything. I can research doctors for you and figure out where you need to go. But I think the biggest thing is to learn your clients and what they need. And also, my goal is not to be with you forever. My goal is to get you through your crisis and teach you how to advocate for yourself. And then you can always come back to me if need be, but teach you how to get through the healthcare system, because if you understand it, it does work.
What do you think the top healthcare priorities are for most people?
I think they are to get appointments when they want to be seen, getting their prescription medications, and being listened to. I think a lot of people think that their healthcare providers don't listen. The office doesn't listen. And to a point, that is true because they can't. They don't have the time. You go see a doctor who might be given 15 minutes, and of those 15 minutes, probably 9 of those are your doctor working on the computer and doing orders and setting you up for the next visit. I would love to see us be able to return to the olden days of medicine, but that's not going to happen. So I guess the top priority is that we need to recognize that our doctors will not do what we want them to do and what we expect them to do anymore. And what we've learned over years to expect from a doctor. We need to be responsible for our own health care. And the minute we take some responsibility, the better it's going to be. And be that we do it by ourselves or have an advocate, but we need to be responsible because the doctors just can't anymore.
After interviewing Myra, I had the chance to speak to one of her clients, Kate Hawkins. Kate found Myra online while looking for a patient advocate. She realized that she had too many health problems to handle them on her own. These included thoracic outlet syndrome, venous insufficiency with pelvic congestion, and May-Thurner syndrome. Kate was only 22 at the time and had her life and career to deal with, but she was being written off by the healthcare system. Kate is a perfect example of how the U.S. health system doesn't work. She wasn't able to get through the front door without the help of a patient advocate. Myra established a relationship with the nurse practitioner because Kate wasn't able to do so herself. I was transfixed by her story as she shared her journey through the healthcare system.
I was living up in Virginia for the past 7 years, and this all started January of 2018. I had come down to Georgia, where I am right now, where I'm from, for the holidays, and I had to drive home when I was living in Harrisonburg because I went to James Madison University. I was living there at the time after I graduated, also working a freelance job. And I remember noticing when I was driving that my arm was kind of swollen and the veins were kind of sticking up, and I was like, oh, that's kind of weird. And I didn't really think much of it, but I just remember feeling very off at the time, and I made it back home. It's like a 10-hour drive, and this was right after New Year's, and it was January 5th of 2018. My whole arm turned purple, and immediately everyone knew it was a clot. And luckily I was with a really good friend of mine who is really good at taking care of people, and she knew exactly where to take me. She took me to the hospital, and they just told me my whole arm was clotted off, and this was all in Harrisonburg. And it's not a very good hospital. It's not like a teaching hospital, RMH, which is Rockingham Memorial Hospital. They had no idea why my arm had clotted off. They just attributed it to me being on birth control. I had smoked a couple cigarettes. I was never a cigarette smoker per se, but I told them I'd smoked cigarettes before, and they just assumed that it was that combination, the birth control and the cigarette usage, because I tested negative for all clotting disorders, and they just had no idea why my arm had clotted off. And when I was in the hospital, the clot also traveled to my left lung from my right arm, so I had a pulmonary embolism as well. And I was in the hospital there for about 2 or 3 nights, I want to say, and they discharged me on Eliquis, which is a blood thinner, and they said, well, you should be fine. And I left, and I had planned before all this happened to move to Richmond from Harrisonburg. And I moved to Richmond only a week after that, thinking that I was good to go, that I just had a clot in my arm, that it was random. And when I lived in Richmond, I found that my arm was hurting all the time still. It was very difficult to live my day-to-day life, even though I was on blood thinners, and it just wasn't working out. And it was kind of like divine intervention in February, about a month later. My aunt, there's a very rare blood disease in my family called HHT, which is when your blood doesn't clot. And I don't have that, but my aunt has it, and she has a lot of issues with it, and she sees somebody at Chapel Hill for that. And she asked me to come down and see her hematologist, and my mom drove all the way up, and we drove down together. I think she might have flown up or something, and we drove down to Chapel Hill, and they just looked at me and looked at my posture and knew from my posture what was wrong with me. It's thoracic outlet syndrome, which is when your posture is kind of hunched over, and it kind of builds up over time, and it usually manifests in your 20s or when you're in your 30s in the form of a clot. And what they did from there is they diagnosed me. They did this procedure. This was all in mid-February of 2018, where they put a catheter into my right arm, did the clot busting procedure, and they told me my whole arm had been clotted off for that whole month. Because the only way to fix that issue is to remove the right upper rib. As long as that rib is there, you're still going to be clotted off, at least in my situation. So they went in there, and my arm had been hurting because my arm wasn't purple, but it was clotted off still. Because thoracic outlet syndrome is very mechanical. So they did this clot busting procedure. I was actually awake for the procedure. It was very interesting, twilight anesthesia. And they diagnosed me by sticking this wire under my collarbone area, and if it bent a certain way, it was thoracic outlet syndrome, and they diagnosed me there and then scheduled me to have my rib removed 2 weeks later. So then I went back to Richmond, came back to get my rib removed, and my arm had somehow already clotted off again. So the surgery ended up being a lot more expensive than they had hoped. They were hoping the clot busting thing would have just cleared it up ahead of the surgery, but then they had to do it all over again, basically. And then the surgery it was supposed to only last a couple hours, and it ended up lasting 8 hours or something. And I was under for a very long time. And I remember when I woke up, it was just very strange. And they told me that my whole chest had been clotted off for 2 years probably before any of this happened without my knowledge. And the blood had just all found new ways to flow, and that was what happened first. And then the arm clotted. And they removed my right upper rib, and that was early March of 2018. But while all this was happening, I kept mentioning, this is where Myra sort of comes in. I kept mentioning to my doctor, Dr. McGinnigal, I was like, my leg's been hurting, my left leg. When I was discharged from RMH in Harrisonburg, I remember I got in the shower, and I had to sit down in the shower because my whole leg was swollen. And I kept mentioning it over and over again, but everyone just kind of ignored it because they were so focused on my arm. And they were just like, oh, it's probably just nerve pain, because I was diagnosed with the nerve kind of TOS and the blood kind. I have 2 kinds of it. So everyone just kind of assumed it was just inflammation or something. And I just continued on about my life. I started working a job in Richmond, but my leg just kept getting really swollen and painful. It just kept happening, and I would have to leave work and go to the hospital, and it was like I was getting nowhere with my health. I went to all these vascular people in the Richmond area. They had no idea what to do about me because I was so young. They just had no idea what was going on. And I ended up having to quit my job and move home to Georgia to figure out just the beginning of what's going on with my leg. So I moved home October of 2018, go to the hospital where I was born, which is Emory DeKalb in Atlanta. And they diagnosed me with venous insufficiency in both of my legs. And, that's sort of where I started to figure things out, but that was honestly just the beginning of it. I thought that everything was kind of solved there and then, but it really wasn't. They just told me to start wearing compression socks and just being mindful of it, and that was that. And I ended up moving to the DC area January of 2019. And at that point, my leg was kind of still bothering me, my left leg, not that much though. And around this time, I also started getting some weird chest pain as well. And things were good for a while, but then in the fall and late summer of 2019, my leg just got so much worse. And then I started having pain in my left side, near my pelvis and my abdomen. And it just got out of control. It was distracting me. I was working another job in the DC area. It was I couldn't focus on anything. And they had me on Tramadol for pain, and it just seemed like nothing was getting solved with it. And I'm this can't just be venous insufficiency. They never said I would have pain in my abdomen and stuff like that. That doesn't make any sense. They diagnosed me correctly with my leg. However, they didn't know what the deeper issue was with my leg. We didn't figure out what the bigger issue was until my mom found Myra, which was, I think we met Myra the summer of 2019, I want to say, like late summer, early fall, and my mom and I had been talking, and I just was frustrated about my leg. I was like, I just can't live my life like this. It's so painful, keeping me up all night. And my mom kind of felt like she couldn't help because she was in Georgia, so we started looking into a medical advocate. And Myra and I just clicked right away when we talked on the phone, and I told my mom, this is who we're going to work with. She got me in at Johns Hopkins, and the way that we did that was I'm trying to remember exactly how she got me in, but she knew some people there, I believe, and knew who to talk to. She helped me with all the administrative parts of it, because to be honest, that's the most convoluted part, in my opinion, with all these health issues, is all the records. I've been to like at least 7 or 8 different hospitals since all this started. I've been in the ER like 15 times since January of 2018.
After Myra got you into Johns Hopkins, did she diagnose you, and did she sort of set a program for you, or did she help you create a new plan?
Yeah, she basically helped me establish a plan, and she listened to my concerns that there was something else going on. Because, I mean, at the time, I had seen a vascular surgeon in Northern Virginia, and he was like, oh, you're just making it out, basically, because you're 20, I was 22 or 23 at the time, like, you can't have anything going on like this. Like, no one wanted to believe it, but Myra understood that what I was talking about was very real. So she kind of did her own investigative work and talked to people at the vascular department at Johns Hopkins, and they suggested that maybe it was May-Thurner syndrome, which is basically it's a similar thing as thoracic outlet syndrome, but with your legs. And it's when your iliac vein is compressed and you have like pelvic congestion, where like all the blood flow is congested in your pelvis. So they asked me to get this MRI, and I got an MRI of my pelvis, and Myra helped me get all of that established, and I got the MRI, sent it to Johns Hopkins. She followed up with them to make sure they got it, and that was how I was accepted as a patient, because when they saw the MRI, they saw it was really bad, that I had it, and that the iliac was compressed and everything. So from there, they saw me, they assumed I had May-Thurner at the time, and we scheduled the May-Thurner surgery, which was November of 2019, and they put a stent in my iliac vein. And Myra there were at least like 2 or 3 doctor's appointments prior to the surgery, and she attended these appointments with me and helped me advocate and get all the facts. She collected all my records from all my other hospital visits for everything else. She was really essential in getting that going, because, I mean, nobody else was willing to look deeper into the issue that I had seen. And she helped me actually see a doctor who could look into the deeper issue of it. And it's also a very rare condition, like thoracic outlet syndrome. Like, generally doctors wouldn't think that someone would have it, as well as thoracic outlet syndrome. Like, that's very rare. So, I had my stent put in November of 2019, and it was so painful. And they were astounded when they saw how compressed I was. They said I was the most compressed person they'd ever seen, and that they were going to use me as a case study for their students and stuff. And they showed me a video of how, like, the vein was, like, ballooned, and then when they put the stent in, it all started flowing. And I could literally feel the warmth coming back to my leg. It was really freaky. And they gave me all this pain medicine, and it wasn't touching it. It was more painful than my thoracic outlet surgery by far, which is bizarre because it's an outpatient procedure. You leave the same day. So they were a little confused at my pain with that. Like, and I've still had some issues with my leg, to be honest, since then. It's just that everything was so congested from the May-Thurner, and the venous insufficiency is from the May-Thurner. Like, that's like the original cause of it, basically. And it's still been a process of rehabilitation since that surgery, even though it was a year ago. Like, my leg is still painful sometimes. But when all of this was also going on, we were juggling the fact that I was having these weird chest pains that just came out of nowhere. It would feel as if like I was having a heart attack or something. I went to the ER at Johns Hopkins once about it, and we ruled out it wasn't heart related. And then Myra connected the dots and suggested I make a telehealth appointment with Dr. McGinnigal, who removed my rib. And Myra was on the telehealth call with us, and Dr. McGinnigal just knew then and there that it was Pec minor syndrome, which is a basically a side effect of thoracic outlet syndrome. It's when your pec minor muscle, like the nerves, are compressed in that area. And it's more like a neurological thoracic outlet syndrome thing. It's not as serious as like the clotting and the blood side of it. So she helped me nail that down as well. Like both of these things with the May-Thurner and the pec minor syndrome, like I wouldn't have been able to get this done if it weren't for Myra, in my opinion. Like she was the one who really set it all up and gave me these ideas to reach out and talk to these doctors about it. And this year I've had 2 surgeries during the pandemic. The first one was late August. My saphenous vein, which is the longest vein in the body, it's like on the inside of your leg, that had been like the problem vein that got really congested from the May-Thurner syndrome. So Dr. Hawley at Johns Hopkins, who put my stent in, he did sclerotherapy to my saphenous vein, which is basically like a man-made clot where you shut down a vein that is no longer working. So they did that, which was a more minor procedure where they just inject a chemical into the vein to shut it down. And I did have a little bit of fallout from that. Since I've moved, I left the DC area in September. And about a month ago, I did have a superficial clot in my leg that was a result of that procedure, which is, they do tell you that these things could happen. Superficial clots, though they sound scary, they're not scary. They just really hurt. They can't kill you. I've had 5 now. I've had 4 in my arm from the clot busting procedure because I kind of have a damaged vein there now. And then I've had that one in my leg a month ago. So I ended up my mom had to drive me to Chapel Hill in the middle of the night. I guess it was almost 2 months ago now when I had the clot in my leg. And it was just like from the sclerotherapy. And it went away on its own, and Dr. McGinnigal assessed me at Chapel Hill, and my leg is fine now, thank goodness. There's not really much else that could happen. The odds of my left arm clotting off are very slim. I just had my pec minor muscle released, which was the nerve compression. The only other things that could possibly happen with these disorders or these syndromes is my left arm could clot off. But I'm prepared for that to happen. If it happens, they'll just remove my rib, and that'll be it. Other than that, I'm in physical therapy for my leg. We're trying to loosen up the muscles. There's some nerve inflammation in my leg as well, and I'm working with a physical therapist on that, as well as the recovery from my surgery a month ago with my chest. So it's mainly physical therapy right now, and just like working on loosening all the muscles, because all the muscles and the nerves have been affected by all of the blood flow stop and everything. So at this point, it's just a matter of following up with my doctors, keeping on track with physical therapy, and just hoping for the best.
So what about exercise? Are you doing any walking or anything to get your body moving?
Walking really helps my leg. So I do walk. I also am a flow artist. I hula hoop, and that helps my arms a lot. So I've been doing that for my arms. And the big thing with thoracic outlet syndrome is you got to keep your shoulders back, because people with TOS kind of hunch over. So just being mindful of how my body is positioned and keeping my shoulders back really makes a difference with my pain from my thoracic outlet syndrome. I'm happy to say that now I'm living relatively pain-free. I'm very happy about it.
Now let's listen to Myra as she explains her process as a patient advocate and how she worked with Kate. So Myra, what steps did you take to help Kate overcome her health challenges?
Kate was complicated. She had a lot of things going on, and I had to first sit down and listen to what her most important and pressing need was. For Kate, her pressing need when she called me was this horrible leg pain and arm pain. I had to understand what needed to get done, and first and foremost, the first things Kate and I did was we had gone to Hopkins because she'd made an appointment with one physician, and after we got there, realized it was not the right physician for her to see at that point, and the doctor didn't receive any of her records. So what I had to do was gather all of Kate's records. I took a copious history from Kate, and her mother got involved too, because she was a nurse and understood it, and then had to figure out where to go. Kate was living in Virginia, and I hooked her up with doctors in Johns Hopkins in Baltimore, Maryland. One thing that Kate and I did was she got me involved with her internist, which was a wonderful thing, because when Kate couldn't get an appointment or couldn't get through because the front desk is notoriously difficult, particularly when you have someone who's really sick and they're not being listened to. So I was able to establish a relationship with her internist, or nurse practitioner, and get through to her whenever Kate couldn't, which was a major undertaking. The other thing was that her doctor in North Carolina gave us a clue as to what was Kate's problem, which is something unusual called pelvic congestion syndrome. And there is a clinic, actually Johns Hopkins, which treats this, but you can't just get on the phone and say, hi, I want to make an appointment to be seen. I had to call and and talk to them and find out what tests needed to be done so they could confirm that Kate had this problem, and then they would make the appointment. So Kate couldn't have done this by herself. I take it back. I suppose she could have, but it would have been very, very labor-intensive and very difficult. Because I had to explain her whole history to the medical person, find out what test she needed, and then I brought the actual test down to Hopkins because I didn't want to get lost in the mail. And then we set her up with the right doctor who gave Kate treated Kate the way she needed to be treated, not the way she wanted to be treated. Because Kate wanted the problem to be resolved right then and there, and Kate had to understand that sometimes things take a while to resolve. And we finally got through that. We had her treated with a doctor in Maryland, then we went back to North Carolina, and I think Kate is now finally on her way. But had she been treated originally the way her doctor in Virginia wanted to, it would have been lifelong problems with her leg.
What kind of clients can you help best then?
I find that I do best with the client that wants to take responsibility and wants to understand what's going on. They realize that getting through the system is very difficult, but having an advocate can open up doors and explain things that they couldn't do on their own. But I work best, as I said, with clients who understand what's going on, are willing to let me take the lead, but are willing then to take over. Typically, with my clients, I meet them, I take a complete history. Actually, now I zoom in, I take a complete history to understand what's going on. And before each doctor's visits, which now we are doing telemedicine versus in person, we discuss what their goal is, what they need, and how to get these things accomplished. So I need people who want to get better, understand the healthcare system, has its challenges, but want my help and then want to be able to do this on their own.
We're coming to the end of the episode, Myra. If one of my listeners has a health challenge that you can help them with, where can they learn more, or how can they best reach you?
Okay, they can go onto my webpage, which is Katz, K-A-T-Z, Advocate, ADVOCAKE.com. They can email me at Myra, M-Y-R-A, at katzadvocate.com. If need be, they can call me at 410-978-3763. I also do give a complimentary phone call to discuss whether or not we would be a good fit, because I think that you need to fit with me as I need to fit with you. That makes us work much better.
Thanks for coming on the show, Myra.
Thank you so much for having me, Derek.
Thanks for listening to the Health Champions podcast. Are you a solopreneur, healthcare patient advocate, or a healthcare practitioner running a small business? Do you have a client that you'd like to feature as a health champion on my podcast? You're welcome to contact me for more information about guest opportunities. My email address is derek@healthchampions.club.
That's DEREK at healthchampions.club.